The sessions we had today were so helpful, especially being able to understand and have a perspective from the patient side. Because I think most of the time as researchers, we have one approach, but hearing and understanding what the patient needs really creates a very collaborative insight that helps us to design studies that are relevant for communities, because ultimately the research that we do in neuroscience, the ultimate goal is so that it can have a better impact on the patients. Hearing that perspective and being able to be very inclusive and collaborate with them from phase 1 all across to the end of the project, it was really a different perspective that opened to my eyes that it's not just about which phase they will get involved. It's important that even from inception when we design studies, they are also part of it. Definitely what I'm going to do is to really look at a wider community and have a better understanding which communities will benefit mostly regarding the research that we do, looking at plants that are neuroactive and ensuring that there is a bit of representation from that community, and also probably even the professional side, the clinical side, so that whatever that we design in preclinical neuroscience is relevant in terms of the patient as the end user and also the prescriber in terms of healthcare professionals. So it's about identifying those different types of communities, and from the onset when we develop proposals for funding, they become part of the team to ensure that their perspective is included and it's really collaborative. We are equal contributors to the project from inception throughout, even towards the end, and even in the end to ensure that the results, the data, it's shared in a manner that can be better understood within the community, whether it means translating into the native language, illustrating what the results mean, really going back to the grassroots level to engage with the communities to see what we started with them, how those results look like, and how it could add value to their communities. Thank you. Okay, the part of the lived experience that I really enjoyed this morning was the 2 sessions, especially the ones that illustrated how patients, how we can incorporate patients into our studies and get to hear that perspective. And in terms of going forward, the way I plan to incorporate that input, it's really identify the 2 different communities, the patient side, the healthcare professionals within the neuroscience, so that they become part of the project design from initiating and designing the project all the way through implementation and getting the report, and ultimately using that data to take it back to the community, whether in translating in the local language, doing illustrations. That way, both, it's really a collaborative and very inclusive environment to ensure that the lived experience experts' advice is incorporated in our neuroscience research. Thank you.